number 1 which is displayed on your screens is: what will be the treatment plan in a 10-year-old child with complicated crown fracture and abscess formation in apical region of 1-2 and with EPT negative for 11 and 1-1? Okay, the question is asking about so the question is basically related to the trauma sustained in a 10-year-old child with the anterior teeth, and the teeth mentioned in the question are 1-1 and 1-2. They are saying that there is a complicated crown fracture and abscess formation in the apical region of 1-2. So this tooth has got a complicated crown fracture. See, crown fractures can be of two types, a complicated and a non-complicated fracture. Non-complicated fracture is a simple fracture in which the tooth segment is usually divided into two. So a fracture which occurs like this is a non-complicated fracture. It is a non-complicated fracture. Okay, but whenever there is breakage of crown into multiple segments, it is called complicated fracture. The tooth crown has broken down into several segments and not only just one or two. So managing and restoring such cases is really difficult, and moreover it is saying that there is abscess formation in the apical region of 1-2. There is formation of periapical abscess in the region of 1-2, and if you look at the age of the child, he is just 10-year-old. So if we talk about the eruption sequence of the maxillary permanent teeth, the central incisors are the first to erupt in the oral cavity at around 7 to 8 years of age. The lateral incisors come at around 8 to 9 years of age. And when the lateral incisors or the central incisors erupt, it usually takes 3 years from the eruption time for the root formation to complete. So if we consider the age of the child in this question, we can see that the lateral incisor is an immature tooth. It is an immature tooth. I am talking about tooth number 1-2. It is an immature tooth with a periapical abscess and a complicated crown fracture. So a tooth which is having a necrotic pulp, incomplete root formation and complicated crown fracture has a very poor prognosis. It is difficult to survive. So the best treatment option for such a tooth would be extraction. Okay. If we talk about the other tooth, that is 1-1, the tooth number 1-1, that is the maxillary right central incisor. In such cases, it is simply EPT negative for 1-1, means the pulp is necrotic. And since the age of the child is just 10-year-old, again the root formation is incomplete with the central incisor too. But it is simply non-vital, immature central incisor. No periapical abscess formation is there and no fracture of the crown is there. So we can save that tooth. And whenever there is a immature tooth with necrotic pulp, the best biological treatment option available is revascularization or pulp regeneration. So we would opt for regenerative endodontic procedures with tooth number 1-1, that is right maxillary central incisor, and we would extract the tooth, that is right maxillary lateral incisor. So if we look at the options, epexification of 1-2 and RCT of 1-1 is partially correct because epexification can be attempted, but this tooth has a poor prognosis, so we would not go with this option. RCT of both 1-1 and 1-2 is again incorrect. Revascularization of 1-2 and RCT of 1-1 and extraction of 1-2 and RCT of 1-1. We cannot do revascularization of 1-2. We have seen that the tooth is having a complex fracture of the crown with a periapical abscess, so the revascularization would likely be unsuccessful because the coronal seal cannot be maintained. So again, this option is ruled out. Looking at option number D, it is extraction of 1-2, which is justified. We have discussed why we have to extract the lateral incisor. And RCT of 1-1, definitely, because it is EPT negative 1-1. The question is saying EPT negative. When it is EPT negative, means there are no viable nerve fibers, the pulp is deemed to be necrotic, and we have to do root canal. So RCT of 1-1 and extraction of 1-2, option D is the best possible answer to this question. So again, whenever it comes to endodontic traumatology, it's an interesting subject. There can be a lot of options. So most important things you have to look for is the age of the patient. Age of the patient helps us in determining whether the maturity status of the tooth is complete or not. Okay, if it is complete, simple root canal can be done. If it is incomplete, without any negative factors like complicated crown fractures, the best treatment available for immature pulpless teeth is regeneration, revascularization. If revascularization or regeneration is not there in the options, the best possible answer, second choice, would be apexification in such cases. Okay. Coming over to question number 2. The question number 2 says 8 to 30 fluted burrs are used for what? Grinding, polishing, finishing, or abrasion of the tooth surfaces. Now, what are dental burrs? Dental burrs are basically bladed cutting instruments, and most of the time the burrs have got even number of blades. Okay, they would be having either 2, 4, 6, 8, 10, 14 like this. The number of blades on the burr is mostly even, and they are kept even because manufacturing of blades with even number is easy as compared to manufacturing of a burr with odd number of blades. So you have to remember that all the burrs which are used for the dental purposes, they usually have even number of blades. Okay, and with 6, 8 or 10 blades, a burr which has got 6, 8 or 10 number of blades is generally used for excavation of tooth structure. When a burr has got 6, 8 or 10 number of blades, it is used for excavation of the tooth structure. Excavation is also called grinding of the tooth structure. Cutting of the tooth structure, grinding of the tooth structure. Okay. With 12 to 30 blades, burrs which have got more number of blades, more numerous number of blades, 12 to 30 blades, they are used for finishing procedures, finishing of the restorations or finishing of the tooth preparation. So as the number of blades increases, the surface which is cut by these blades with greater number, it is smoother as compared to the surface which is produced by a burr with lesser number of blades. So what you have to remember, that when the burr has got 6, 8 or 10 number of blades, it is used for cutting the tooth structure or excavation of the tooth structure, which is sometimes also called as grinding of the tooth structure. And whenever the number of blades is numerous, from 12 to 30 blades, it produces a smoother surface, it is less efficient in cutting, and such burrs are used for finishing procedures. So looking at the options, the answer to the question would be C, finishing. Okay, because it is asking 8 to 30 number of blades. The number of blades is high, and you have to always remember that number of blades is directly proportional to smoothness of the preparation. Smoothness of the preparation. Okay, you get a smoother preparation whenever you use a blade with a larger number of operational surfaces or blades. Okay, coming over to question number 3. It is a relatively simple and direct question, an image based question which are frequently asked in these examinations. What is the instrument used here? what instrument is being used over here. You can see some testing has been done with the instrument. This instrument is there in the patient's tooth, and you can see there is a lip clip. There is a lip clip over here and an instrument. So the options given are Diagnodent. Diagnodent is basically a device which is based on quantitative laser fluorescence. Quantitative laser fluorescence. It is also a pen-like device which transmits laser light and is used for pulp vitality testing. Diagnodent. Okay. EPT or electronic apex locator. Sorry, electric pulp tester. Apex locator or quantitative laser fluorescence. So if you look at the options, Diagnodent is the brand name of the device which works on quantitative laser fluorescence. So basically speaking, options 1 and 4th, they are the same. Okay. Looking at the option number 2, electric pulp tester. Yes, you can see there is a meter over here, a digital display is there which measures the quantity of current, and this lip clip, it completes the electrical circuit. It completes electrical circuit. So the current flows from the device to the tooth, and we can check the status of the viable A delta nerve fibers. What fibers are tested with electric pulp tester? A delta nerve fibers. Looking at the lip clip, you can get confused with apex locator, because our apex locator is also a device which uses a lip clip. But in an apex locator, there is nothing like this device which is contacting the tooth. We put a file inside the tooth which is contacted with a probe, and the other thing is a lip clip placed on the patient's mouth. So a lip clip is present with both apex locator and EPT, but you can see here the device is contacting the surface of the tooth, so it is an electric pulp tester and not electronic apex locator. So answer to this question would be 2. Okay. Coming over to question number 4. Which is the best method for isolation during vital pulp therapy? Cotton roll isolation, rubber dam isolation, salivary ejector, or silagogues? See, silagogues are basically the medicines which stimulate or increase the production of saliva. Definitely whenever we have to do tooth isolation, we have to control the saliva. So silagogues is ruled out. Silagogues are the drugs which increase the lubrication in the mouth. They increase the production of saliva. So this definitely is not the answer. We are left with options 1, 2 and 3. It is asking for best method of isolation. Best method means almost complete isolation should be there of the tooth being treated. Cotton roll can be used, but do not provide the best isolation because they frequently need to be changed during the procedure, and there are always chances that during the changing of cotton rolls, contamination of the operative site can occur from saliva. Rubber dam definitely is one of the best methods for isolation in all clinical situations, and salivary ejector or a suction tube again is not the best. So looking at the options, you can easily answer that the option 2 is the correct answer to this question. Option 1, 2 and 3, all 3 are the methods of isolation, but the best method of isolation is rubber dam, which when placed properly would completely isolate the tooth being operated from the oral cavity without any chances of contamination from the saliva. Okay. Question number 5. That is the last question related to my subject that came in INICET examination. An evulsed tooth which is replanted 1 year back shows loss of lamina dura radiographically, high metallic sound on percussion. So what type of resorption the tooth is showing? So the question itself says 2 signs. One is a radiographic sign, that is loss of lamina dura. Okay, Another is a high metallic sound on percussion. A tooth evulsion is complete articulation of the tooth, and whenever we do a treatment of our evulsed tooth, the treatment consists of intentional replantation or replantation of the tooth. Okay, we curate the socket and place the tooth back into the socket. So whenever tooth is replanted back, it is likely that some residual infected PDL cells are there, which when the tooth is replanted back into the socket would initiate an inflammatory response that would result in external inflammatory resorption of the tooth. Okay, so what is the most common sequelae of an evulsed tooth? It is external inflammatory resorption. The root would start resorbing. Okay, it is a replanted tooth and there would be resorption of the root, which is called external inflammatory resorption, abbreviated as EIR. And the second outcome, this is the most frequent outcome of an evulsed tooth, and the second frequent outcome is tooth ankylosis. Tooth ankylosis. Tooth ankylosis means whenever we replant an evulsed tooth back into the socket, over time what happens, because the PDL fails to regenerate, there is fusion of the tooth with the bone and the tooth becomes ankylosed. This is the second most common sequelae of an evulsed tooth. The question is saying there is loss of lamina dura. Loss of lamina dura means there is complete fusion of the tooth root with the bone and a high pitched metallic sound. A metallic sound occurs whenever the junction of the tooth and the bone is complete, means no intervening PDL is there and the tooth has become ankylosed. In such cases, because of the resonance of the bone, there is a high pitched metallic sound. So replacement resorption, inflammatory resorption, external resorption and internal resorption. If you look at the options, inflammatory and external resorption, they are the most common sequelae, but the question is saying there is loss of lamina dura and a high pitched metallic sound, so the answer would be replacement resorption. Replacement resorption is also called tooth ankylosis. So answer to this question would be 1, that is tooth ankylosis. Okay, so numerous type of questions are related to this tooth evulsion. Endodontic trauma is one of the favorite subject, especially for the INICET examinations. Tooth evulsion, I have told you what is the most common sequelae, external inflammatory resorption. Whenever the external inflammatory resorption occurs, the PDL would not be disturbed, there would be no loss of lamina dura, and there would be a normal sound, a resonant sound on percussion, but not a metallic sound on percussion. The second most common sequelae is that there would be replacement resorption or fusion of the tooth with the bone, which is called tooth ankylosis. This would result in loss of lamina dura and a high pitched metallic sound. So the answer to this question is 1. So these were the 5 simple questions, straightforward questions related to the subject of endodontics. They came in the November INICET examination. Okay, and these are the answers and the explanations to them. Keep studying. All the very best, students. With this, I am signing off. Thank you very much.